Welcome to our channel dedicated to health and wellness. Here, we strive to provide you with the latest information and practical tips to help you live a healthy and fulfilling life. Whether you're looking to improve your fitness, eat healthier, manage stress, or simply learn more about wellness, our channel is the perfect place for you. So, if you're ready to take control of your health and well-being, hit that subscribe button and join our community today. Tirzepatide is a new and innovative treatment for weight loss that has shown tremendous promise in clinical trials. The medication is designed to target the hormones that regulate appetite and metabolism, resulting in significant weight loss in patients with obesity. Not only does tirzepatide help patients lose weight, but it also improves blood sugar control and reduces the risk of cardiovascular disease. Tirzepatide is a therapeutic medicine, an acylated peptide that many refer to by its brand name, Mounjaro. Pharmaceutical experts classify tirzepatide as an anti-diabetic drug that experts incorporate into the regimen for type 2 diabetes. A medicine that many healthcare providers consider to counter excess weight and obesity off-label is tirzepatide. The social pressure to maintain a healthy weight and conform to a certain mold is constant. Even if some don't give in to the pressure, their sagging bodies and the dangers they pose to their health drive them to take drastic measures to maintain weight. Getting a healthy BMI and losing weight can be much more difficult than we might think. Far beyond the conventional weight loss measures, it often demands dieters to follow holistic approaches and sometimes medical assistance too. As you seek professional support, your doctor assists you through intensive behavioral therapies and regimens to lower your fat percentage. These may involve medical nutrition therapy, an effective set of exercises, pharmaceutical drugs, or even surgical solutions. Overall, this method for getting lighter on your feet is simple. The hormones that tirzepatide mimics play a pivotal role in inducing the satisfying feeling we get after meals. This is to balance the amount of food our body needs with the amount of food we consume. As the peptide induces satiety, your craving to eat and gorge on calories decisively diminishes. This puts you in a better state to push your body into a calorie deficit. Tirzepatide is a new medication that has shown great promise in the treatment of type 2 diabetes. It is a once-weekly injectable medication that combines two hormones, glucagon-like peptide 1 and glucose-dependent insulinotropic polypeptide, that work together to regulate blood sugar levels in people with type 2 diabetes. In a recent clinical trial, patients who received tirzepatide lost an average of 12.4% of their body weight over 72 weeks, compared to just 2.4% in patients who received a placebo. In addition, tirzepatide also led to significant reductions in A1C, a measure of blood sugar control, as well as improvements in other metabolic markers. Tirzepatide is administered once a week via subcutaneous injection and is generally well tolerated by patients. Common side effects include gastrointestinal symptoms such as nausea and vomiting, but these typically subside over time. If you're struggling to lose weight and improve your overall health, tirzepatide could be the solution you've been looking for. Customers rate the weight loss properties of tirzepatide with an average rating of 4 out of 5. According to them, the drug uses an extremely favorable approach to counter weight and brings it down without much effort. Many feel that it simplifies the slimming process by overcoming the recurrent temptations getting in the way of their progress. Generally, the doctor expects tirzepatide to lower the body weight by up to 10%, which is quite a significant number. Similar to an anorectic, it helps you keep your hunger under control and eat a healthy amount of calories. However, despite many vouching for its weight loss powers, there is a segment that mostly discusses its flip side. It is the users that have faced disappointment over the occurrence of its complications, majorly the ones related to digestion. Some claim that it messes up their stomach constantly, contributing to issues like constipation and pain. Others appear to be upset with its downside of repeatedly inducing diarrhea-like symptoms. In general, these feedbacks appear to be mixed, with some focusing more on the positive aspects than others. GLP-1 and GIP both stimulate insulin secretion, which helps to lower blood sugar levels, while GLP-1 also reduces glucagon secretion, which helps to prevent the liver from releasing glucose into the bloodstream. By combining these two hormones, tirzepatide provides a more powerful effect on blood sugar control than traditional GLP-1 receptor agonists. Tirzepatide has undergone several clinical trials, including a recent Phase 3 trial called SURPASS-4, which involved over 2,000 people with type 2 diabetes. In this trial, tirzepatide was found to be significantly more effective at lowering HbA1c levels, a measure of blood sugar control over time, than both insulin glargine and semaglutide, two commonly used medications for type 2 diabetes. Tirzepatide was also found to promote weight loss, with participants in the trial losing an average of 11 pounds. Another Phase 3 trial showed that tirzepatide was also effective in reducing the risk of cardiovascular events in people with type 2 diabetes who were at high risk for heart disease. In this trial, tirzepatide was found to be superior to both placebo and semaglutide in reducing the risk of major adverse cardiovascular events. In addition to its effectiveness in controlling blood sugar levels and reducing the risk of cardiovascular events, tirzepatide has also been found to be well tolerated in clinical trials. The most common side effects include gastrointestinal symptoms such as nausea, vomiting, and diarrhea, but these are generally mild and transient. Tirzepatide is a new medication that has recently been approved by the U.S. Food and Drug Administration for the treatment of type 2 diabetes. It is a once-weekly injectable medication that combines two hormones, glucagon-like peptide 1 and glucose-dependent insulinotropic polypeptide, that work together to regulate blood sugar levels in people with type 2 diabetes. GLP-1 and GIP both stimulate insulin secretion, which helps to lower blood sugar levels, while GLP-1 also reduces glucagon secretion, which helps to prevent the liver from releasing glucose into the bloodstream. By combining these two hormones, tirzepatide provides a more powerful effect on blood sugar control than traditional GLP-1 receptor agonists. One potential downside of tirzepatide is its cost. As with many new medications, the price of tirzepatide is expected to be high, which may limit access for some patients. However, the benefits of tirzepatide in terms of blood sugar control, weight loss, and cardiovascular risk reduction may outweigh the cost for many patients. The cost of tirzepatide falls on the exorbitant side of the range. In general, the monthly expense of the medication will be around $1,100, which equals approximately $13,200 a year. Sadly, general insurance companies do not offer coverage for the drug. And so, it makes tirzepatide price not too budget-friendly for all GLP-1 receptor agonists in terms of efficacy and safety. It is also not clear how well tirzepatide will work in patients with more advanced stages of type 2 diabetes. Another area of research that may be important to explore is the use of tirzepatide in combination with other medications for type 2 diabetes. For example, it may be beneficial to combine tirzepatide with a sodium glucose cotransporter 2 inhibitor, which is another type of medication that can help to lower blood sugar levels and reduce the risk of cardiovascular events. Overall, tirzepatide is a promising new medication for the treatment of type 2 diabetes. Its unique combination of GLP-1 and GIP provides a more powerful effect on blood sugar control than traditional GLP-1 receptor agonists, and its effectiveness in reducing the risk of cardiovascular events is particularly noteworthy. While its cost may be a barrier for some patients, tirzepatide may offer significant benefits for those. Tirzepatide is a novel dual glucose-dependent insulinotropic polypeptide and glucagon-like peptide 1 receptor agonist that has recently gained approval from the United States Food and Drug Administration for the treatment of type 2 diabetes. The medication is delivered subcutaneously once weekly and has been found to produce potent glycemic and weight-lowering effects. The objective of this paper is to provide an overview of tirzepatide's pharmacology, efficacy, safety, and clinical implications. Obesity should be treated like any other chronic disease with effective and safe approaches that target underlying disease mechanisms. The various studies show that tirzepatide is accomplishing this. These results are an important step forward in expanding effective therapeutic options for people with obesity. On average, 9 out of 10 individuals with obesity lost weight while taking tirzepatide. In conclusion, tirzepatide is a promising new medication for the treatment of type 2 diabetes. Its unique combination of GLP-1 and GIP provides a more powerful effect on blood sugar control than traditional GLP-1 receptor agonists, and its effectiveness in reducing the risk of cardiovascular events is particularly noteworthy. While its cost may be a barrier for some patients, tirzepatide may offer significant benefits for those with type 2 diabetes who are looking for effective and well-tolerated treatment options.